In the United States, an estimated 37.3 million people have diabetes, representing 11.3% of the population. The prevalence of diabetes is expected to increase in the coming decades. In fact, it is projected that by the year 2030, there will be about 51.7 million people with diabetes. Complicating matters, one American study estimated that today approximately 47% of patients with diabetes have some degree of peripheral neuropathy. You may be wondering, how has diabetes changed over the years? Well, to give you an example, in 1980 there were 0 cases of type 2 diabetes in adolescents. At that time, type 2 was known as adult onset diabetes. By the year 2010, there were 57,638 adolescents with type 2 diabetes. And by 2017, just 7 years later, that number skyrocketed to 213,000. A CDC study estimates that if current rates continue and the population increases, there could be more than 500,000 young people with diabetes in the year 2060. So why has diabetes and its related conditions continued to steadily rise? We haven't changed as a species in that amount of time, but we have changed as a culture. The manner in which our food is produced, the quality of our food, and the types of food that we have and continue to consume has changed over the years. So what happened? Well, this happened. Big Tobacco amassed millions in profits by selling cigarettes to generations of addicted consumers. Rather than reinvesting in their existing industry, they funneled this wealth into a new market, one with a far broader reach. This market encompassed people of all ages, races, ethnicities, and financial backgrounds, and its influence would extend far beyond the present, shaping consumers' health and well-being for years to come. This industry wasn't just another vice. It was something essential to daily life: the food we eat. In 1985, R.J. Reynolds acquired Nabisco Foods for $4.9 billion. That same year, Philip Morris purchased General Foods Corporation for $5.6 billion. And just 3 years later, Philip Morris expanded further, acquiring Kraft Incorporated for $11.5 billion and merging it with General Foods to form Kraft General Foods. With this move, Philip Morris became the largest food producer in North America, wielding an unprecedented level of control over what millions of people consumed every day. These same corporations that once hooked people on tobacco took control of our food production. Then, by utilizing the very same marketing tactics, they push highly processed foods worldwide. These products, filled with artificial additives and chemicals disguised as food, were designed to be addictive. By engineering flavors and ingredients that triggered overconsumption, they conditioned people to eat more than ever before. As a result, this shift in the food industry played a major role in the widespread health issues we see today. We have all been made addicts without even knowing it. We get all up in arms when drug dealers lace gummy bears with fentanyl and pass it out to grade school children. Yet we had no idea that the tobacco industry has been doing this same thing right under our noses. It makes total sense that they have used the same tactics that they have done in the 1950s with tobacco as they're doing today since the 1980s with sugar. It seems that once again, profit has been prioritized over public health. In order to change the trajectory that our population is on, we must become aware of what we must do as individuals to change our habits and not follow the masses. Is it possible to change our fate? The answer is yes. Our office is committed to showing you how. A lot of people think that once they get diabetes, they just need to take some medication, watch what they eat, and they'll be okay. because over time, that's what they are trained to believe. As time goes on, reality shows us that this treatment protocol is not effective. If it were effective, we wouldn't have people suffering from neuropathy and having amputations. If the pills worked, amputations would stop. Neuropathy due to diabetes would not exist. Diabetes would be cured. The standard medical model does not get to the underlying cause of the condition. I hope that by educating the patient about how food is processed and how diabetes develops, I can help them make better decisions. This, in turn, may allow them to recover from diabetes and avoid complications such as neuropathy and amputations. This program will also aspire to aid in the recovery from diabetic neuropathy as well as other forms of neuropathy.